This video will focus on the topic of elimination. The learning outcomes for this video include identifying the prevalence, risk factors, and clinical course of urinary elimination disorders. We will also cover discussing diagnostic tests, developing nursing care plans, and implementing best practices for clients with elimination problems. As a quick review, the urinary system eliminates waste and excess water and aids in acid-base and electrolyte balance. The upper tract includes the kidneys and ureters, and the lower tract consists of the bladder, urethra, and pelvic floor. When assessing the urinary system or elimination, we look for things like the pattern of urination, perineal condition, bladder distension, and residual urine. We also assess the urine's characteristics, such as color, clarity, odor, and output. This table shows the average daily urine output by age, ranging from 15 to 60 milliliters for a 1-TO 2-day-old infant, up to 1,500 milliliters or less for older adults. Urinary elimination disorders include renal stones or kidney stones, also known as lithiasis. These are crystalline masses that can obstruct urine flow. A large stone formation filling the renal pelvis is called a renal staghorn calculus. Causative factors include bariatric surgery, inadequate fluid intake, and conditions like diabetes and gout. This slide shows a visual representation of the kidneys and mentions different stone types. Prevention of stone formation involves a continuous flow of dilute urine. Adults should aim for at least 2,500 milliliters of urine output every 24 hours. Changing urine pH can also reduce renal calculi. This can be achieved using ascorbic acid or dietary modifications like cranberry, prune, or lemon juice. This table outlines different types of renal stones, their risk factors, and corresponding interventions to manage or prevent them. The stone types include calcium oxalate, calcium phosphate, uric acid, struvite, and cystine. Kidney stones may not always cause symptoms, but smaller stones moving through the ureter can cause severe pain and bleeding. This pain is typically felt in the flank, over the affected kidney, and radiates downward toward the genitalia and inner thigh. Nausea and vomiting can accompany severe pain. Diagnosis involves a CT scan of the abdomen and pelvis, an ultrasound, or a KUB X-ray. Urinalysis checks for blood or albumin, and blood and urine studies determine levels of stone-forming substances like calcium, uric acid, and cystine. Treatment initially focuses on flushing the stone out with IV or oral fluids and managing pain with medications. Medical expulsive therapy, or MET, using alpha blockers like tamsulosin may be recommended for small stones. If stones don't pass, cystoscopy or surgical intervention may be necessary, and lithotripsy uses sound waves to break the stone. Further treatments include irrigation via a ureteral catheter. For stones 5 millimeters or larger, a ureteral stent may be used to maintain patency. Percutaneous nephrolithotomy, or PNL, is an incision into the kidney to remove a stone and is used when shockwave lithotripsy is ineffective. Nursing management during the initial assessment includes gathering concise information about pain, changes in urinary output, and urine characteristics. All urine must be strained to recover stones for analysis. Post-procedure care involves monitoring for infection, bleeding, urine output, and pain. Preventative measures are planned based on chemical analyses. Benign prostatic hyperplasia, or BPH, is the enlargement of the prostate gland, which can obstruct urine flow. Symptoms, such as difficulty urinating and a decrease in the strength of the urine stream, appear when the growth presses against the urethra. Urinary flow stasis, or retention of more than 60 milliliters of residual urine after a void, can occur in later stages. Diagnosis involves a digital rectal exam and pressure flow studies. An ultrasound can measure residual urine volume and differentiate BPH from prostate cancer. A serum creatinine level can also rule out renal insufficiency. Immediate catheterization is used for emergency situations where the patient cannot void. Surgical intervention is indicated for incontinence, hematuria, urinary retention, bladder stones, and urinary tract infections. Minimally invasive techniques like balloon dilation and laser resection can help relieve symptoms. The most effective way to reduce symptoms is through surgery, including transurethral resection of the prostate, TURP, and open prostatectomy. This table lists different types of prostatectomy procedures. Open prostatectomy involves an abdominal incision and carries a risk of infection and erectile dysfunction. Transurethral resection of the prostate, or TURP, is the gold standard, performed under spinal anesthesia using a resectoscope to excise and cauterize obstructive tissue. We will now discuss the pharmacology of medications used in the treatment of elimination disorders, starting with finasteride. Finasteride, marketed as Propecia and Proscar, is an androgen hormone inhibitor. It works by inhibiting 5-alpha reductase, which reduces dihydrotestosterone, thus preventing the development of benign prostatic hypertrophy. Its therapeutic outcome is reduced prostate size and is used for symptomatic BPH and male pattern baldness. This slide provides further details about finasteride, including its classification and action. Adverse effects of finasteride include impotence, decreased libido, and gynecomastia. Contraindications include pregnancy, breastfeeding, and hypersensitivity. Pregnant women should not handle the tablets. Next, we will cover tamsulosin hydrochloride. Tamsulosin, known as Flomax, is a peripherally acting anti-adrenergic. It selectively antagonizes alpha-1 adrenergic receptors, especially those in the prostate, causing relaxation of smooth muscles in the prostate capsule. This improves urine flow in patients with BPH. This slide provides additional details on tamsulosin, including its classification, action, and uses. Adverse effects of tamsulosin include dizziness, headache, orthostatic hypotension, and abnormal ejaculation. Contraindications include hypersensitivity, and precautions should be taken with severe renal disease and prior to cataract surgery due to the risk of floppy iris syndrome. Moving on to doxazosin. Doxazosin, or Cardura, is a peripherally acting anti-adrenergic. It is an antihypertensive that also decreases symptoms of BPH by blocking alpha-1 adrenergic receptors, which relaxes smooth muscle in the bladder neck and prostate. It's used for hypertension and BPH. Adverse effects of doxazosin include dizziness, headache, orthostatic hypotension, and priapism. Contraindications include hypersensitivity to quinazolines, and precautions are advised for pregnant or breastfeeding women and those with hepatic disease. Finally, let's discuss tolterodine. Tolterodine, or Detrol, is an anticholinergic. It acts as a competitive muscarinic receptor antagonist, reducing bladder smooth muscle contractions and the urge to urinate. It is used to treat symptoms of overactive bladder, such as urinary frequency and urgency. This slide provides additional information on tolterodine, including its classification and action. Adverse effects include anxiety, fatigue, dry mouth, constipation, and vision abnormalities. Contraindications include hypersensitivity, uncontrolled closed-angle glaucoma, and urinary or gastric retention. Precautions include pregnancy, renal or hepatic disease, and decreased GI motility. Next, we will cover oxybutynin. Oxybutynin, or ditropan, is an anticholinergic and antispasmodic. It acts as a muscarinic receptor antagonist, directly relaxing smooth muscle in the bladder. This is used to treat urinary frequency, urgency, and incontinence associated with neurogenic bladder or overactive bladder. This slide visually displays the drug, oxybutynin. Adverse effects of oxybutynin include anxiety, dizziness, blurred vision, nausea, constipation, and urinary retention. Contraindications include hypersensitivity, GI obstruction, urinary retention, and glaucoma. Precautions include pregnancy, cardiac disease, and dementia.